Okay, so since you started with a joke, now I have to start with one. I had the opportunity to speak in Denmark, actually, about a week and a half ago at a design school. And I got home after, crazy long travel, and I noticed a girlfriend of mine had posted on my Facebook page about an article that had been written in Denmark, and how they use the word Texas. So are any of you actually from Texas here or living in Texas now? Okay, so you know what the Denmarkians say when they say something is insane or just totally crazy? They say, that is so Texas. So I don't know that that's a compliment or not, but whatever, everything's bigger in Texas, we'll take it. So I'm not a usual suspect, and my company is not always a usual suspect at these types of events. So I thought I would tell you just a bit about who we are so that you've got some context for why I'm here. And I absolutely love being in new environments and with new folks, so thanks so much for having me. I'm part of a company called Frog Design. We are about a 43-year-old product service and design firm. We were started by that guy, Hartmut Esslinger. And Hartmut's sort of guiding ethos and guiding principle that has followed the company all the way through to where we are today has been that form follows emotion. So we all know form follows function, right? Something has to be functional for us to use it and to actually think it's valuable. We would actually say that the emotional connection that you have with that thing is even more important than the function of that thing. What we love is what we use. What we love is what we adopt. What we love is what we keep over time. We do a little bit of everything. We design service experiences. We design hardcore hardware experiences. And we've had a healthcare practice for about 35 years or so. That's my space. It's the space that I'm most passionate about. And clearly, for all of you here, we know what an incredible time it is to be in the healthcare industry. There's a lot going on. I was asked to come speak to you guys a little bit about what customer service means to me, and what I think customer service is changing to mean in our current day and age. So I first wanted to define our terms. Service is quite literally defined as the act of helping or doing work for someone, right? Makes sense. Service is doing something for someone else. You guys do this every single day. Experience is to encounter or to undergo an event or an occurrence, to be the recipient of someone actually getting service of some kind. So I think what I would posit is service isn't about the experience that you're receiving, but that service actually is the experience. What people actually remember about what we give to them or what we do for them is the experience of it, the way that it actually made them feel. So service has changed a lot over the years, and I wanted to kind of harken back to where I think at least us Americans kind of how we think about service, right? We come from this kind of can-do attitude. We have always felt really good about being able to do it ourselves, right? We're the get-her-done group. We don't want somebody to tell us how. We don't need somebody else to do it for us. We want to do things ourselves. We want to take care of things ourselves. And that's been, in evidence since way back. That's how we've always worked. And in a really interesting way, the very thing that has allowed us to be the most innovative, or one of the most innovative societies out there, and to do all of these incredible things, it's actually ended up sort of disintermediating our ability to actually help ourselves. So anybody, is this what most people's car hood, under the hood looks like? Right? So back in the day on that previous picture, you could have gotten in there, worked on that engine, taken care of it, fixed it, gotten there and done it yourself, right? Now it's under this plastic thing. Everything's got a piece of software attached to it, and we're not able to actually engage as much anymore. We can't actually do for ourselves as much as we used to, which is an incredibly frustrating thing, right? Like that's actually to be disintermediated, or disempowered from the ability to take care of yourself is a frustrating and often incredibly scary thing. But I think what we could argue is that the pendulum is actually swinging back. And I think if you know, or if you look at who is, at all of us in this room, right? Like it's it's a different world than sort of the World War generation might have experienced with technology. They might have been more wary of or fearful to get in there and try and do for themselves. We're not like that. We're pretty willing to jump on in. We're all very comfortable with our smartphones and figuring things out. And sort of back to that car analogy, I remember about 2 or 3 years ago, there was something wrong with my Volvo. And I couldn't figure it out, and I didn't want to take it into the service guy because I knew it was going to take a half a day, and I knew it was going to cost me $400, and I knew I was going to have to take time off. So I literally went onto YouTube just to see if it was something simple enough that I could just do it myself, right? So you go onto YouTube, there are thousands and thousands of videos by people posting things to help us do what it is we need to do. We don't always have to go into the service environment anymore, right? There's more and more ways. This is just one example of people sort of taking that initiative back on their own and being able to do what they want to do on their own. You know, and in healthcare, it's interesting, and lots of industries are still undergoing massive change, obviously, but we're in the middle of a really big one. And we've gotten used to this, right? Like, this is what our waiting rooms look like. This is what our ERs look like. People are sitting and waiting to be told what to do. They're waiting for somebody to come and make it happen for them. But what we're actually used to in the rest of our lives is this, right? Being on hold for a service representative, or sitting at the DMV, or sitting in the ER or in the doctor's office doesn't feel like regular life anymore. What we do in the rest of our connections and the rest of the industry engagements we have is often immediate and transparent, right? So everybody's well aware of the Nike fuel ban and the rise of the wearable, right? We know what we're taking in. We know how many steps we're walking. We know how much what our heart rate is all day long. Netflix sends us stuff immediately to our door, takes it right back, or you stream it down over the web. It's all right there. We are very, very accustomed to be able to get what we want when we want it at any given notice. So I wanted to share a couple of examples of companies that I think are doing innovation and doing service really, really well. And I would love for you to sort of think about these companies in light of what you do, and see if you can find the analogy, find the parallel that your organization might take if you thought about things in the way that these companies are doing them. So the first one is easy, right? I bet everybody knows about Zappos. I'm sure you've all heard the Zappos sort of case study. They absolutely were, sort of at that forefront of putting the customer first. Their actual company motto was powered by service. Their employees are empowered to make decisions on the phone, on the fly. They don't have to call somebody. They don't have to go up the chain. They're able to just do. One little tidbit that you may or may not have heard about that I think is actually really fascinating is that every year their employees go through their customer or their employee evaluation. And in that evaluation, not only are they asked, how was it? Did you have a good year? Here's where you did well. Here are your growth areas. They are also asked, quite literally, do you want to stay? They're asked, do you want to come back and work another year? And if the employee doesn't want to, the company policy is, that's okay, thank you so much, here's a severance, and we part ways happily, and you go on your way to do the next thing that you're going to do. There's no shame in leaving, there's no there's no being dissed and walked out of the front door. They actually pay you if you want to leave, because they want to sort of recognize and embrace the good that you brought to that company and send you off with a really powerful message about how valuable you are. That's amazing. I mean, how many of your companies do that, of your organizations do that, right? Celebrate the success of what that person gave to you even as they walk out of the door. Yelp is also a really interesting one. Do you guys know that Yelp was actually started by a couple of people who were trying to find a good doctor? So Yelp was started by a group of friends who were just trying to figure out who they should go to, right? And what this has really ended up to me in embodying is the democratization of the feedback loop, right? So with Yelp, we all know you can go check any company, any restaurant, anything, and get often hundreds, if not thousands, of reviews from people saying what they thought about the service, about the experience that they got at that particular place of business. It's an incredible, incredible social media tool. And one I think that, organizations like us, we're all still, trying to pull in customer sat scores, all that kind of good stuff. This isn't going away, and it's only going to get more and more pervasive, right? That social expanse and that social feedback loop is incredibly powerful. Ask anybody in advertising these days how they feel about this sort of stuff, and you'll see their faces go pale. It's redefining that industry. The promise of magic. This is another one that I really like. This one's near and dear to my heart because Frog actually had the opportunity to work with Disney on this very piece of technology there. So we partnered with Disney for a long time, and they came to us several years ago and said, we're having a problem, we have an issue. People are not getting through the lines fast enough, we're losing share, and the parks aren't doing as well as we think that they should be. Will you come help us figure out what's wrong? We said, sure, we'd love to do that. So as is part of our process, we went out into the Disney parks and actually watched what was going on. And we talked with patrons and we talked with people about what they were experiencing and how their Disney vacations were going. And what we heard back time and time again was people saying, I don't feel like I planned well enough. I don't feel like I got my money's worth. I feel bad that that my kids didn't get to do X, Y, or Z. So there was this really odd sense of guilt that people were actually harboring about their experience with Disney. So if you take that and sort of look at the two sides of that coin, there's a match there, right? You've got Disney on the business side saying, we're losing money and we feel like people aren't having a good time. And on the flip side, you had people in the park saying, I feel guilty and like there's not, I didn't optimize for my trip. So our work with them was to actually come up with the Disney Magic Band, which is a little RFID-enabled plastic wristband that's customized to every person in the family. Has anybody done this with your families yet? You guys done this? Yeah. And the idea was that each of these is unique to the person that's wearing it. So if it's mom and dad and a couple of kids, everybody's got their own band. And what's really cool is it's the way that you get in and out of the park, so there's no ticket. You're not holding paper, you're not losing things. It's the way you get in and out of your hotel room, right? So there's no key. It can be your wallet. So if you want to put $50 on that sucker and give it to your kids, then nobody's losing money. It's all safe. You're not having to worry about, and they can't spend any more than whatever you put on their ticket. And it also is personalized enough that when your daughter's birthday happens to be that day, Minnie Mouse can come up to her and say, "Happy birthday, Katie. We're so glad you're here," right? All just enabled by that one little piece of technology. And on the back end, what it does is it allows them to actually do everything from estimate how long the waits are in the line. They can look at the park overview and see, oh my gosh, it's packed over in this part of the park. We need to start wayfinding and directing people over there. They can do actual space planning and wayfinding from this thing. I keep waiting for somebody to say, hey, let's try and do this at my hospital. Or hey, let's try and do this in my facility. What if we took something like this and thought about what would it be like to actually create a seamless system where everybody could know everybody, we could find each other. It's an opportunity and an innovation moment waiting to happen in healthcare. And then the last one, we all know Uber, right? What's cool about this is, two things. So one, Uber actually started in a very first world way. There was a couple of guys who were at a web conference in Paris, and it was raining, and they were lamenting about how difficult it was to get a cab. So they literally dreamed up Uber sitting, in a coffee shop in Paris, and in the meantime have managed to upend an entire industry, right? They took something, they answered a human need. I just need to get a cab when I want it, where I need it. I don't want to have to worry about haggling over tip. I don't want to have to feel uncomfortable in the back of this car. I don't want to have to deal with waiting. I want to be able to see it as it gets to me. Easy as that, easy as that. And now they've got an entire taxi industry having to relook at who they are and what they do, right? They're having to sort of reassess their whole industry. I feel like we're in the middle of, well, we're all waiting for our Uber moment, right? We all know that there's something coming. There's something right at our heels. And the job of you all and those of us who work in this industry with you is to help you find that Uber moment, right? How do you redefine what you do? How do you stop looking at the way that you've been doing it for all of these years and give yourself a minute to look at it completely differently and to rethink that idea of service? Healthcare is about service. That's all we really do, is try and serve people. But it's about taking that lens off and looking at it from a very, very different way. The brand is not about what you make, it's about how you make people feel. So again, I just want to come back to that idea that I started with, right? Your brand is not about the service that you provide. The brand is about the impression that you leave with that human being. The brand is about how that patient feels at the end of the day after being with you, about how that child feels after having been undergone an operation. So you want to make them feel good. You need to make them enjoy the actual experience. Thank you very much. Have a good one.
Excellent. Thank you very much, Lindsey.